Hello and good evening. I'm Melisa Idris. Welcome to The Future is Female. This is the show where we find the extraordinary in every woman. Sudan is in the midst of a severe humanitarian crisis. Millions are being displaced and the healthcare system there is collapsing. So that will be our focus on the show tonight, because joining me as my guest today is Dr. Annie Lin Sheng-Yi, who is an anaesthesiologist with Médecins Sans Frontières, also known as Doctors Without Borders. She has served on multiple MSF missions and in some of the toughest humanitarian settings there are, and has recently returned from a mission in Sudan. So welcome to the show, Annie. Thank you so much for joining me. Before we go into the recent mission that you returned from, can you tell me first a little bit about yourself and how you came to, I guess what first led you to work in humanitarian medicine?
Okay. Yes, thank you for the introduction. Yes, I'm an anesthesiologist from Taiwan, and I joined MSF, Doctors Without Borders, since last summer. So far I've had 3 missions. The first one was in Afghanistan, and the second one was in Sierra Leone, and the third one, the most recent one, was in Sudan. Yeah, so I just finished the mission in Sudan, and arrived back home in Taiwan last Thursday. Right. Yeah, it's really recent. Yeah. Okay.
How did you start to become involved with MSF and being sent on missions? Is there something that you need to do to be able to be deployed into MSF missions?
Well, actually, the application process was really normal. Like, I applied online, and there were some interviews, and they asked me to write some articles about abortion, and you have another more interviews, and then about after half a year, and then I was accepted. Yep. And then after about another half of a year, and I finally got my first mission. It was in Afghanistan. Yeah. And then, yep. Yeah.
What made you want to be part of humanitarian medicine work? Because as an anesthesiologist, if you were to practice in Taiwan, I'm sure it's a very comfortable life. It would be hard work, but you would also be in a safe environment, in a kind of orderly. You'll be practicing medicine with all the trimmings, right?
Yeah.
Working in a conflict zone, working with a humanitarian organization like MSF is hard. What made you decide you wanted to be part of it?
That's a very good question. I think it's because I really want to see different worlds other than the modern medical settings, and also in Taiwan, I think it's because the government health insurance makes it's so cheap and so convenient to get to see a doctor. So sometimes Taiwanese people they didn't cherish this so much, and so that's why I really want to go to those places that really need the medical help the most. Yeah.
So you were in Sudan during October, November. That was end of October. Was the violence in Al Fasher?
Yes,
Sudan.
Yes. So October 26th.
So you were in Sudan when Al Fasher, the horrific violence that we saw, the scorched earth tactics, the violence, the sexual violence, the killings all happened there. Talk to me a little bit about your experience. I'm so curious to know. Let's start from when you first arrived. You were based in Tawila.
Tawila, yes.
Okay, so talk to me about what that was like. The first 24 hours when you arrived, what was it that you saw, and what were your, I guess, what was required of you in this mission?
Well, I arrived at the end of September and started working on the 1st of October. And among all the 3 missions I had so far, this mission is definitely the most remote one, the most austere one, because I had to fly to Chad first, and then took the UN small flight to the border, to the small place called Andre. It's at the border of Chad and Sudan, and then I took the car, and it took us 3 days from the border of from the border all the way to Tawila.
Oh,
Yeah,
wow.
and the road condition was really bad. It was bumpy and it was like sand, the sand road. And our car didn't have AC, so we had to keep the windows open to have the good ventilation. Yeah, so when we arrived, my luggage was covered with sand. Yeah, and the environment of our guest house and the hospital, it's really, I have to say, primitive, because there were like insects everywhere. There were like lizards and flies, and also mice. Yep. So
I confess, Annie, that I hadn't heard of Tawila before your coming on the show and doing research for this interview. I think many of us who are very far away from Sudan may not understand just how geographically large Sudan is, but also how hard connectivity is in Sudan from Khartoum and Darfur, North Darfur and the like. So where exactly were you based? And talk to me about the position of Tawila and how it's quite close to Al Fashir.
Yes,
so when there was violence in Al Fashir, many people were displaced and moved to Tawila. Okay,
yes.
Talk to me a bit about that.
Yes, our hospital is in Tawila, and even though the distance, according to the Google map, the distance from El Fasher to Tawila is only like 56 or let's say 60 kilometers. Okay. But you may think, okay, it's only 1 hour drive away, but because the road condition is really, really bad. It's like the sand is up and down, up and down. So according to the OT nurse, she came from a space very near Al Fasher. It's called Zamzam Camp, all the way to Tawila at the beginning of this year. And it took her 3 days to reach to Tawila. Wow. And the first day she had to ride the donkey, and the second day and the third day she paid for the truck, those very big trucks that can accommodate like hundreds of people. Yeah, those big trucks. So it took her 3 days to come to Tawila. Yeah.
So you arrived end of September, early October, and talk to me about what you saw and how maybe it progressed after the Al Fasher violence, and many of the survivors arrived in Tawila seeking medical attention.
Yeah, before the mass casualties, before the fall of Al Fasher, because I work in the OT, so averagely there were like 6 to 8 surgeries per day before the fall of Al Fasher, but after October 26th, because there were like too many people coming from Al Fasher. For example, there was one night, statistically, there were 889 people coming from Al Fasher to Tawila in one night. So among them, a lot of them, they were like trauma cases because of the civil war, and also because the people they stuck in Al Fasher for a long time, because RSF had besieged Al Fasher for 18 months. And during those 18 months, they didn't allow people coming out and didn't allow supply, including the food, getting into Al Fasher. So people stuck in Al Fasher, they didn't have food.
Yeah, starvation, right?
Yeah, so they really, from kids to the elders and pregnant women, they really suffered from like very severe malnutrition status. Yep. So yeah, they're like quite weak, and also because of the war, so they got injured by gunshot or bombarding, and also because the hygiene there was not good, so also infection was quite easily developed and could be very severe. Yeah. So that's why we suddenly had so many trauma cases, infection cases. Yeah.
When I read news reports about the the war in Sudan, I read, statements from the UN, for instance, that say 75% of the health facilities in Sudan have collapsed. The healthcare system is collapsing. It's non-functional. It's barely operational. Help me put that into a reality for Sudanese people. What does that mean for the patients, for the wounded, for the mothers and the children and civilians who need medical attention? In practical terms, when a country's healthcare system has been decimated, 75% of it has been decimated, what does that mean for the people of Sudan in your observations or experience, Doctor?
Well, for example, for the pregnant women, they could not have regular checkup before giving birth to their babies. So yeah, also among all the 3 missions I've had, in Sudan, there were much more dead babies. Yep, during the C-sections. Yep, the babies were already dead before the mother came to our hospital. Yeah.
Wow. Okay. Yeah. Were you given medical training? Did you have to prepare for yourself mentally or emotionally before you went on the mission? And I can only imagine, because who would have imagined the horrors that happened in Al Fasher would come to light? I mean, it's horrified the whole world, because we could see Google images, Google Earth images of blood on the sand that can be seen from a satellite in space. Were you prepared for what you saw in
Actually,
Sudan?
I did, because I think it's a coincidence. I didn't expect that during my stay there will be the fall of Al Fasher, and there will be so many patients, the mass casualties would happen. So I didn't expect that. But before the mission, or before every mission, MSF would prepare ourselves. We would have a lot of briefings in different aspects, like the cultural briefings, the medical briefings, and we would have also handovers from our previous, my previous anesthetist. Yeah, so we can have a better preparation for our mission.
Right. So you went in there already kind of ready to serve, ready to be of help to the patients of Sudan. Talk to me a little bit about the challenges of operating. I'm wondering whether medical aid or humanitarian aid was allowed to come into Tawila. Did you have access to aid? Because you mentioned in Al Fasher, no aid, no food was allowed in. Was there access to medical supplies where you were based?
Well, so far, Tawila is still a relatively safe place. So that's why a lot of people from Al Fasher came to Tawila. So even though the road condition was not good at all, but at least the road is fine. Even though alongside the road, all the way from Chad to Tawila, there are a lot of different checkpoints. We always had to stop, and the military would came up to us and checked our documents. But and that's all. It was actually quite smooth. Yep. So so the supply actually was fine. Yep. We used that route. The only problem was the condition of the route. It was so bumpy. So that's one of the reasons that the X-ray machine could not be transported to our hospital. So the hospital in Sudan, the project is really the lack of a lot of facilities. We didn't have X-rays. And the lab data, the blood tests. Yeah. We could only do hemoglobin and blood sugar, and that's all. We didn't have any other blood tests like the thyroid function, the cardiac enzyme, or the electrolytes, any other very basic blood tests.
Yeah, so that must have made it very challenging to practice.
Very challenging, very challenging. Wow. Yeah.
Well, how did you have to adapt? And I'm sure that not just the healthcare professionals or the people trying to help each other, but also communities. Sudanese themselves have had to adapt to living in this war that's been going on for a while now. Have you seen examples of how that's given you hope? You know, of examples of resilience that you've seen during your time there?
Well, like, because luckily, at least like all of our national staff, they were not injured or killed by the war, but they have like friends and family in El Fasher, and some of their loved ones were like injured or even passed away. So from time to time, I would see that suddenly the OT nurse or the nurse at the IPD suddenly like cry and because she got the news that she lost her family or friend. So we would let her like take that day off and to calm and to calm herself for that day. But afterwards, when she came to work, she still tried to put herself together and work hard and even like smile and greeting each other, everybody. So so I still feel like even though they had encountered such a big disasters, but they still try to manage it very well and try to put themselves together like in a very like, I have to say, very fast way.
So resilient. Dr. Annie, can I ask you, you've been to multiple missions. Do you think the world is paying attention to what is happening in Sudan?
I have to say no. Comparing to like Ukraine or Gaza, maybe much less. And that's also why like during the past 18 months when RSF were besieging El Fasher, making the people starved in El Fasher, we didn't do anything to stop it.
And I noticed the mainstream media coverage of Sudan is also not as much as we would, doesn't really compare to the suffering. We don't really read about the suffering that's happening, the devastation that's happening there, which is why I really love talking to MSF, because I feel that you always bear witness to what is happening. You come back and you tell the stories of what is happening in the conflict zones that you serve at. Talk to me about how important that is. How important is it to, as a medical professional, I know sometimes you're taught to be neutral, but because of the responsibility of witnessing, of bearing witness, and then sharing that story with the rest of the world, how do you see your role in sharing that story?
Well, I think this is also a very important part for to tell the truth, to arouse the attention, because if we don't pay attention to them, they're being ignored. Their condition would not end. Their condition would only get worse. Yes, so that's why I'm willing to have so many interviews and try to remind people that even though you're so lucky, you're like living in a very convenient modern environment. You have food, you have clean water, and you can see the doctor in a very in like several days. Very very convenient, but you have to be grateful. These are not like things like should be taken for granted, and also peace. There's no war here, but it's not. These are things that should not be taken for granted. On the contrary, you should be grateful, and also you should like try to help those who's really in need, because you have the capacity, you have the ability to do so. So.
Before you went to Sudan, what do you think people misunderstand the most about not just the country, but the conflict that's happening there? What is it that we, when we were watching from afar, we don't really understand? Is there anything that you would like us to know about the humanitarian crisis there?
I would say maybe one of the reasons people didn't pay much attention to the crisis in Sudan was because it's civil war. It's not like Ukraine and Russia or like the Gaza problem. So maybe people would say, "Oh, it's your own problem. It's none of my business because it's your like Sudanese and Sudanese like attacking each other." But I have to say that the Sudanese people, they're innocent actually, and the genocide was happening, is happening. It's not. It should be stopped. Yeah.
Yeah.
So even if you can, I have to say, the war. Maybe there's we cannot avoid the war, but we really should stop all those tortures, all those genocide. Yeah.
What is it that we can do? So the public watching today, you said, we shouldn't take things for granted, but we should also do all we can to support, to try and help and end the violence.
Yes.
How do we support humanitarian work? How do we maybe raise awareness about these types of injustices?
Well, I think firstly, pay attention, and constantly paying attention to all those disasters, and also remind people around you that the disasters are still going on, and if you could like donation, because there the founding budget from like USA is like much cut down this year.
They have reduced their funding for these types of humanitarian missions.
Yes. So yeah, I think even though you cannot go to the front line to help the local people, but I think that's what we can do. Yeah.
For sure. So are you going to be going on other missions in the future? Do you want to continue your humanitarian medicine work?
Yes, of course. I really wish that I could have at least 1 to 2 missions per year, so that also like I would not forget how the local people, how the real condition is, and also I can bring my experience and share with other people, and to remind them, to pay more attention to those in need.
Yeah. Can I ask you if there's anyone watching today, young women especially, if they're interested in humanitarian medicine, but they might be hesitant because of the dangers, because of the risks that they may be exposed to, what would you say to them? How would you encourage them to maybe consider this path?
Well, actually, I'm not quite sure about other NGOs, but MSF, for your first mission, usually you would be sent to some chosen projects that's not like in the conflict zone.
Okay.
Yep. For example, my first mission was in Afghanistan, but actually after 2021, after the evacuation of American army, there's no war in Afghanistan, so now they're like in a relatively
rebuilding,
peace,
right?
They're rebuilding and peace status. So if you're really interested in like the humanitarian work, usually for the first mission it would not be so tough, so crazy. So you can try and to see if you can like how you manage, how you face all those like very brutal conditions. If you can manage it well, you think it's okay for you, then you can, just like me, you can take the second one, the third one. And if you really don't like it, you cannot make it, that's fine. Then you can just like donate or pay attention.
But at least you try.
Yeah, at least you try.
Can I ask you, Annie, from the first mission from Afghanistan, then Sierra Leone, and then Sudan, how has the work changed you? Practicing trauma medicine in a conflict, in an active conflict zone. How have you changed as a person, as a woman, as a medical professional? Has it changed you?
Yes, definitely. Just like mentioned, every time when I come back from the missions back in Taiwan, I was like so grateful, so grateful for everything, for like clean water, for food, and like when I was like taking a bus in Taiwan, I was so happy that, oh, the bus has AC, and the road is like not bumpy at all. Yeah, so yeah, everything was like magic for me. Like, oh, it's so convenient, it's so fast, it's so cozy, so comfortable.
You don't take anything for granted anymore.
Yeah. And also like, so, and also like, there's some like difficulty to get used to other people who like, because other people, they're getting used to this kind of environment, so they would take used to it. They would take granted for it. And I say, no, you should not. Like, clean water.
Was it
like
hard
this.
to adjust back to, because you had been in such in a conflict zone? Was it hard to adjust back? Do you feel that it's harder to adjust to relatively normal, safe life again?
It needs some time. It needs some time. But otherwise, my family or my friends would say, it's not a big deal. What are you doing? Yeah, something like that.
You've seen things other people haven't, which is why it's important to tell your story. Dr. Annie, thank you so much for being on the show with me, for sharing, for bringing us your stories from Sudan and other missions. Thank you for your time.
Thank you.
That's all the time we have for you on this episode of The Future is Female. I'm Melisa Idris, signing off for the evening. Thank you so much for watching, and good night.